Latest on the coronavirus. The death toll in the United States has now risen to 6, with all of those deaths happening in Washington state. 18 confirmed cases in that state and more than 100 across the country. Here in Maryland, 6 people have been tested. 5 of those tests have been confirmed to be negative. 1 is still pending. We have WMAR2 News' Megan Knight live at the health department there in Baltimore City. So Megan, what is the criteria that would force someone to get tested for coronavirus?
Well, Christian, there are essentially 3 different categories that would warrant a test of the coronavirus. This, of course, means that a person would be showing signs and symptoms already of the virus, which includes things like fever, cough, shortness of breath. So one reason why you might test somebody is obviously if they've been to an area recently that has been heavily impacted by the coronavirus. China, of course, is a big one. Other countries include Iran, Italy, and South Korea. Another reason would be if that person has come in contact with somebody who either has or had the virus. And then also if somebody has very severe symptoms, perhaps enough to get them into the hospital, but they have tested negative for the flu. That's a big issue right now, is that the flu and the coronavirus have very similar symptoms. So people are being tested for the flu first before they're getting tested for the coronavirus. State agencies now stepping up their efforts to get the facts out there about the virus, how it can spread, and more importantly, what you can do to prevent it. The Trump administration says that governors will be reimbursed for at least some of what they spend to contain the virus, things for like testing and protective gear and public information campaigns. And in fact, the state health department has already released a couple of public service announcements about this, trying to ease people's fears about this deadly virus.
It's important to know the vast majority of people recover from this infection. Many patients will only have mild to moderate symptoms.
Now, unfortunately, there's a lot of misinformation and misconceptions out there about the coronavirus. One of the big ones, though, is wearing a mask. You're seeing people snatch up these face masks right and left, but health experts say they actually don't do a whole lot when it comes to preventing from getting the virus. And if you're healthy, you should just skip the mask altogether. It can actually make you sick because you're constantly touching your face, taking the mask on and off. Also, there are currently no cures or vaccines for the coronavirus, though scientists around the country and world, including a team here in Maryland, are working to develop one as we speak, but still nothing on the market right now. So if you see any sort of ad or email claiming that you can purchase medicine to cure or vaccinate yourself against the coronavirus, just know that that is a scam and do not waste your money. We're live in downtown Baltimore. Megan Knight, WMAR2 News.
Megan, thanks very much for that. And we, of course, have set up this special section where you can find the latest headlines as well as safety tips about the coronavirus. It's on the website, WMAR2news.com. On this special section, we'll continue to update that as new stories surface locally, nationally, and internationally.